So around advising patients about working when they have a condition, absenteeism, this new word, presenteeism, I think it's quite tricky. And you ask a question about how do we advise? Well, actually, because I haven't really thought so much about it, and I was very struck by this data, I've been giving that some thought recently, and I think actually I'm not sure that doctors and nurses are really well equipped to advise with regard to that. I think the work intensity in modern times is very, very high, and so it's not surprising if patients, are having to attend hospital, are experiencing high levels of fatigue, that they do find this difficult. But I think, again, a question was asked about, well, what's the actual control rate? Should we actually expect that working when you're ill in an otherwise healthy population is zero? I don't think it is, actually. So it's a little bit about, I think, it's about openness and honesty, discussing with your employer, setting realistic goals. If you feel that there are difficulties, then there are ways of actually obtaining help and advice with that. That might be available in the charities sector, for example. In the UK, I'm thinking about Macmillan or Citizens Advice. But I think the important thing is for physicians to be aware of this as a phenomenon, and for patients to also feel that they know where to go for advice.